Hello and welcome to Your Health Reclaimed with DrPND, where we help you reclaim your health with tips, tools, and resources to live your most optimal and vibrant life. Here's your host, DrPND.
Hello and welcome to Your Health Reclaimed. This is your host, DrPND, and I'm really excited to have you guys today again for another episode that we're going to be discussing in relationship to blood sugar regulation, in particularly high insulin or hyperinsulinemia that is called. So this actually episode is sort of a continuation, or is going to piggyback from what we talked about last episode, which was regarding PCOS, polycystic ovarian syndrome. And one of the biggest driving factors in PCOS, which is seen very, very often, is high insulin or hyperinsulinemia. Okay, so what we're going to talk about today is this, and I want to talk about a little bit of how things are being misdiagnosed, generally how the process goes in looking at insulin and why it should be tested, and ultimately discussing what is optimal insulin levels, how to best find out if you have hyperinsulinemia, what are the best tests available there, and also generally what can be done to completely reverse hyperinsulinemia. High insulin is reversible, so is type 2 diabetes. So if anybody says otherwise, they are most likely not correct. I just want you to keep that in mind. Excuse me. So here we go. Now we all know that, or at least we should know, that chronically elevated blood sugar or blood glucose is a major driving force behind our current and ever-growing epidemic of chronic disease. Everyone knows about type 2 diabetes and the ramifications that can have unless it is addressed properly. So things like blindness, limb amputation, kidney failure, neuropathy, nerve damage, cardiovascular disease are among the very common diseases that are seen and are caused by type 2 diabetes that is not addressed properly. So research indicates that health can become compromised even when blood sugar, blood glucose, is below the diabetes and the pre-diabetes cutoff ranges, but it is still higher than what is considered normal or optimal. So sometimes that's far less appreciated, however, is that it is possible to have perfectly normal blood sugar, yet still be at risk for severe health problems down the line. And a lot of people, unfortunately, are really not aware of that. Okay, so when it comes to blood glucose control, glucose alone does not tell the whole story, unfortunately. In fact, it's a very single-minded focus on glucose, and that has really caused what may be an even more important part of the metabolic health to be overlooked, and that is insulin. So most people tend to think of insulin just as the blood sugar hormone, or the hormone that brings down blood sugar. The fact is that insulin has many, many other extremely important roles in the human physiology, almost to the point that just lowering blood sugar is one of the least impressive things that insulin really does. So if you have been, for instance, experiencing symptoms that, your doctor has not been able to explain, regardless of following what you think is a healthy diet and lifestyle, and are suffering, for instance, with things like chronic joint pain, acne, fertility, hypertension, erectile dysfunction for males, migraines, skin tags, and recurring skin tags, and among others. A lot of times, chronically elevated insulin, it is at the root cause of those issues. Okay, and that's something that we're going to talk about again a little bit, how to address that. So let's talk about a little bit of hypo and hyperglycemia. That's basically low and high blood sugar. A healthy, well-regulated body keeps the blood sugar within a relatively narrow range. Okay, so usually when blood sugar is about 99, that's milligrams per deciliter on your blood test, you'll see an mg/lowercase d, uppercase L. That stands for milligrams per deciliter. the equivalent of 5.5 millimoles per liter, or mmol/L. That's the other form of measurement that excuse me, some labs will use. That usually is indication that you have only about 1 teaspoon of glucose in your entire bloodstream. And that is usually the 99 is the cutoff healthy range. In functional health, functional medicine, holistic health, we like to see that number in the 80s to 90s, depending on the person. Everybody's a little bit different. But when you start to get up above 100, that's really not optimal for most people. So, kind of just keep that in mind. And we're going to discuss that in a little bit more detail. So when blood glucose drops too low or drops very quickly from a previously high level, signs and symptoms of hypoglycemia will occur, such as feeling shaky, dizzy, lightheaded, nauseated. Other symptoms can include sweating or having a very, very racing heart. Any severe cases, obviously, can cause seizures, or unconsciousness, obviously, can result as well. On the other hand, when you have hyperglycemia, that's blood sugar that is very high, it causes damage slowly and silently, and that is the big problematic one. The hypoglycemic is more of a nuisance and unpleasant symptomology, but the hyperglycemic state is really the deadly silent one that causes great damage. So over a long period of time, the damage will occur. That's regardless. And hyperglycemia is very widespread, and the symptoms can be varied, but a lot of complications will take place, and obviously, will result ultimately to type 2 diabetes. And we all know, again, the harmful effects of chronically high blood glucose and blood sugar. By the way, if you hear me use blood sugar and blood glucose, these are synonymous. So just in case. But as you guys know, type 2 diabetes will cause great damage to small, large, and blood vessels, leading to eye damage, which is neuropathy, nerve damage, as I said before, which is called neuropathy, kidney damage, then nephropathy, stroke, cardiovascular disease, poor, slow, or very, very slow, non-existent wound healing, and other complications. So, these are very, very important, very big issues that a lot of people struggle with, and they needlessly struggle with. I can't tell you how many, clients and people I've known over the years that have had amputations that all they had to do is reverse their type 2 diabetes. I have seen and actually known people that all they had to do is take control of their type 2 diabetes and get off of dialysis 3 times a week. I had a good friend of mine. He's a local physician. He's a nephrologist. He owns a clinic, and part of his services they do dialysis. And he has said on numerous occasions anywhere from 75 to 80%, and that's on the low estimate of his patients could get off dialysis permanently if they were reverse, they would lose weight and reverse their, type 2 diabetes. But it is really, it's a phenomenon that how many people are unwilling to do that, and yet they would rather struggle and get degenerated, debilitated, and eventually, drive themselves to an early grave, as opposed to just really getting control of their lifestyle and their dietary habits. So anyway, moving on. So one of the things that I want to continue on is talking about the flawed diagnosis of type 2 diabetes. There's a major flaw with how type 2 diabetes is traditionally diagnosed. When doctors suspect a patient has type 2 diabetes, blood glucose or your blood sugar typically is the only one that they think that is measured. Sometimes they'll do a hemoglobin A1C, and rarely they'll go all the way and do an oral glucose tolerance test known as OGTT. So all these are measures solely of the blood glucose, the blood sugar. Okay. The HbA1c is generally taken to represent a 3 to 4 month average of the blood glucose levels. However, there has been definitely controversy regarding that, and it's been debated on how accurate this actually is. The oral glucose tolerance test involves taking a measurement of blood sugar, fasting, then drinking a liquid containing anywhere from 75 to 100 grams of pure glucose, depending on the body weight, and measuring the blood glucose again at intervals afterwards. So usually, typically, is 30 minutes after, 60 minutes, and then 120 minutes after the ingestion of the blood of the glucose drink. And they, look at how fast the body will bring the blood sugar down. So, and there's a key reason why these tests honestly are problematic. For many people, the test will show normal blood glucose measurements. Again, I didn't say for everybody, but for many folks will show that the blood glucose measurement is actually normal. But the problem with that is they're only normal because glucose is being kept in check by sky-high insulin. Okay, so a large body of research has been shown that chronically high insulin is the culprit in many serious chronic health problems, even when glucose or blood sugar is normal. See, this is what I'm going to try to drill in today with you guys, the best that I can, is that you can have normal blood sugar. Your fasting blood glucose on your blood work or CBC, CMP can be normal. Your A1C hemoglobin can be normal. And even if in the rare cases a doctor does prescribe OGTT, the oral glucose tolerance test, that too can be normal. Yet you still have a lot of metabolic conditions and your health is not well enough, which we're going to get into that. So that is something that I'm going to really try to really drill today, the best that I can. So let's talk about a little bit about the Kraft test. There was a physician, he recently passed away a few years ago in 98, a brilliant physician. His name was Dr. Joseph Kraft. He was a medical doctor. He actually coined the terms diabetes in situ or occult diabetes to describe the situation. Ultimately, occult means hidden diabetes. So that is defined as, defined as high glucose, but it's hidden by the high insulin. Okay, so you have high blood sugar, but it's being taken down fast because of your chronic high insulin levels. So for many people, fasting glucose and A1C are the last really things to rise, and for them to officially get diagnosed with diabetes. Unfortunately, they're late indicators of your metabolic dysfunction, becoming elevated only after one of the two things really that happen. And the two things that happen are the pancreas can no longer pump the extraordinary amounts of insulin required to keep blood glucose within a safe range, and that is called sometimes they refer to beta cell burnout. The beta cells are just unable to produce any more insulin. Or number two, the pancreas still secretes large amounts of insulin, but some of the body's cells, or most of them, no longer respond to the insulin properly, resulting in high blood glucose. So when that happens, that is called insulin resistance. So your pancreas makes the insulin in very high amounts, but your cells are not intaking it, and therefore they become resistant to that insulin. So this really explains why many people are surprised by the diagnosis of type 2 diabetes or even pre-diabetes. So everything was normal literally up until months ago, last year, physical is normal. All of a sudden they come in, they do their normal blood routine work, and the doctor slaps them with a diagnosis, hey, you're pre-diabetic or you're diabetic. And then I go, wait a second, where did this come from? I literally was perfectly fine up until months ago, last year, whenever the last physical was. And this is the reason why, because you reach one of those two phases. Either the insulin's beta cells can no longer produce insulin, or it can happen both, that you have also insulin resistance as well. So this is how this dysfunction occurs. The thing is that a lot of doctors have been fooled into the false sense of security by glucose measurements that fall within the normal ranges for years, perhaps again decades, because insulin wasn't being measured, and something that it should have been measured in the first place. So Dr. Kraft, as we talked about, his research indicated that this situation, which is normal glucose due to high insulin, is much more common than it really is recognized. So as we'll see soon a little bit here, I'm going to show you the long-term effects of chronically elevated insulin are staggering. Type 2 diabetes is merely the tiny exposed tip of an enormous iceberg of devastating metabolic dysfunction that remains hidden to the conventional allopathic medical world. And ultimately, this is why we're dealing with this insane amount of chronic disease that we're seeing in our country and pretty much every westernized country in the world, give or take. I mean, when I go to Eastern Europe, last year we were there with my wife, and I cannot tell you the poor state of health that was present in the people there. I mean, it's absolutely insane. Now they're actually, in my country, the death rate as of last year was actually almost twice the birth rate. It was insane. And I'm not talking about, natural healthy, aging and natural death. It's people die from, rampant amount of chronic disease. So it's a big problem. And I really, really hope I do a good job to a point that you guys can understand that principle and really do something about it. Okay, so let's talk about chronically high insulin. So having come from a checkup where, their fasting glucose and A1C were normal, many people get a clean bill of health with regards to the risk of type 2 diabetes. Again, they might have even gone as far as the physician ordering the oral glucose tolerance test and say, hey, you're normal, everything is great, you're fine, I'll see you next year. But what if they know something isn't right? A lot of people have a feeling, I don't really feel the best, or perhaps they might not feel the best, but because they were told everything's normal, they think, what's really in my head? Who knows? And some people, honestly, generally speaking, without knowing better, they think they feel better. But, there's a fire brewing, and it's only a matter of time until it explodes, okay? For instance, a lot of people struggle to lose weight despite exercising and eating a healthy diet, or what they think, at least, is a healthy diet. Regardless, is a lot better than what they used to do. So relatively speaking to what they are used to and how they change with diet and exercise, regardless if it's not really the most optimal for them, they still should lose something. But a lot of times they keep gaining, and at best they stop gaining, but they don't lose anything. So they wonder, why is that? A lot of people have skin tags that they might have them removed from the dermatologist for the skin tag just to literally come back, or for another one to take place somewhere else, and they never stop. Like a lot of women experience infertility or amenorrhea, due to polycystic ovarian syndrome, the PCOS that we spoke about on last episodes, that we covered, very thoroughly. So, a lot of men deal with erectile dysfunction, enlarged prostate glands, high blood pressure is rampant, and again, a lot of those people are thinking they're doing well, regardless of diet, exercise, avoiding sodium, still a problem. High triglycerides, again, a lot of those people, they embrace the dogma of following a low-fat diet religiously, and exercising and, eating, somewhat healthy, especially with a low-fat diet, they still have high triglycerides. And in reality, all these are signs and symptoms of chronically elevated insulin, okay? Independent of blood glucose levels. High insulin is called hyperinsulinemia, okay? There was a physician named Gerald Raven, MD. He was one of the first physicians to actually recognize the severely seemingly unrelated issues clustered together in patients. And he hypothesized that seemingly that's because those clustered issues together, they likely had the same underlying cause. And the issues often found together were abdominal obesity, high triglycerides, elevated blood sugar, low HDL, the good cholesterol, elevated blood pressure, and also elevated fasting blood glucose. Say, not knowing what the underlying cause was, Dr. Raven coined the term syndrome X, which some of you guys might have heard that. But over time, research really has revealed the underlying factors to be, honestly, elevating insulin, and the name changed from syndrome X to what's called now metabolic syndrome. A lot of people are familiar with the fact they have a metabolic syndrome. So it could just, honestly, be easily called just insulin syndrome, or insulin resistance syndrome. Who knows? But some doctors, I don't know, quite rightly call it, insulin resistance syndrome. And I'm really glad they do, because ultimately that's what it is. So it's a state of it's a sad state of affair because it has become so prevalent that it's really is ridiculous, and that is something that really should be tested, but it's not. I was really surprised a few years ago when we went to get our life insurance, and they did a very, very thorough background check on medical records, and they did an extremely comprehensive blood panel. And to my surprise, pleasant surprise, I was really glad to see that they looked at fasting insulin, fasting fructosamine, and uric acid. And those last two I'll go into another episode or podcast regarding, but these are very important markers to be able to really see how healthy somebody is. And what is interesting is the life insurance company required that. So how come then your regular physician doesn't do it? Good question. We don't know. But the fact is that the life insurance company did it. That means they know that they can start seeing potential for disease way before it really propagates into a symptomology. So anyway, I thought that was really, really, really interesting. So anyway, but unlike metabolic syndrome, which is a nebulous and unclear term to most, people, calling it insulin resistance syndrome, I think that hammers home loud and clear that the main problem is insulin. In order to trigger diagnosis of metabolic syndrome, a person has to show at least 3 of the 5 criteria. And those criteria are waist circumference, which is greater than 35 for women and 40 inches for men. Triglycerides, which is greater than 150 milligrams per deciliter. HDL levels that are lower than 50 for women and lower than 40 for men. Blood pressure that is higher or equal than 130 over 85. And last, fasting glucose that is above 100. And that is great. But however, the astute observer will notice that something is missing, something very important. And the official diagnosis criteria for metabolic syndrome, aka insulin resistance syndrome, does not include elevated insulin level in that criteria that they use all the time. In other words, the underlying factor driving the condition is not even taken into consideration, is not even tested for. Anyway, let's go into signs and symptoms of chronic hyperinsulinemia, insulinemia. Keep in mind that with regard to metabolic syndrome, it is not necessary to have all 5 issues above to be diagnosed. A lot of times, having 3 or more or using medication to control them is sufficient to prompt diagnosis based on standard medical standards. However, if you have just 1 or 2, it's still worth assessing whether you have a chronically high insulin. Regardless how you feel, how you are, even if you're in your youth and you're perfectly healthy, I'll begin to measure those insulin levels now when you're healthy, so you know what optimal levels are for you. And from there, as you age, run those tests every year so you can start seeing changes. Because if your diet and your lifestyle are not optimal, you will eventually start to see those shifts down the line as the years go by. Blood sugar creeping up a little bit, definitely insulin beginning to change, which will be the first thing that begins to change. So it's always good to test when you're early, healthy, optimal, and then keep testing as you age and you progress to life. That way, you know if something's going on. Look at like your engine's yellow light. The light comes on, yellow is really not a big deal. Hey, when you just go ahead and check the engine, everything's fine for now, but potentially something's going to happen. When the yellow light begins to blink, that's usually saying, okay, you really need to check things out. But when it comes red, especially blinking red, things are about to bust, things about to break. And that's when, you really should have been paying attention to that steady yellow light way back, because it's so much easier to prevent something or even reverse something when it's the low-grade initial stages, as opposed to being deeply rooted and chronically, in there. So here are some of the conditions that are really associated with chronic high insulin levels. And again, even when glucose levels are normal. And remember, this is only a handful of them. It's not everything. But hypertension, obviously obesity, cardiovascular disease, PCOS, as we spoke in the previous episode, gout, erectile dysfunction, benign prostate, hypertrophy, hyperplasia, skin tags, migraines are huge, vertigo, tinnitus, Meniere's disease, Alzheimer's and dementia. Sometimes something else to keep in mind, I'm sorry, is that while insulin resistance is often associated with being overweight or obese, millions of people are at a very normal body weight or within at least a healthy body mass index. Okay. Many have chronically high insulin, and they still are at a very serious risk for health problems, even though again their body mass index or their health and their weight, so in general, is very normal. So honestly, research even has names for situations when there are clear signs and symptoms of metabolic dysfunction in people at a normal body weight, what is called normal weight obesity, or metabolically obese normal weight. And thus, while a slim and trim physique might look nice on the outside, it's no guarantee of health on the inside. A lot of people have heard or might have heard the term TOFI. It's a kind of casual synonym. It stands for thin outside, fat on inside. Basically, the person looks good and they're thin on the outside, but on the inside they're not good. They actually have adipose tissue. A lot of times, that's a classical example of a male that is slender and thin and well functioning, but they have this little, almost like a pregnant hard belly that is protruding. And even, there's no visual there's no visual subcutaneous body fat, and the person is lean. It can a lot of times be actually even muscular. But that's your typical, TOFI scenario. And you see that in different levels all the time, but weight, it can be very deceiving, especially for older adults, particularly women, because a lot of times a woman, and again, a man, but in women primarily, it can be the issue of sarcopenia, loss of muscle mass, and also osteopenia, which is the predecessor of osteoporosis. So people that are unhealthy, they might have their weight being within a 5-pound range from their high school, college days, and they're well healthy, genetically well put together. And then as they age 20, 30, 40 years down the road, I weigh the same or very close to it. Okay, great, but you look completely different, because now you put on body fat, you lost precious muscle mass, which, by the way, makes a big difference in how blood sugar responds and your blood sugar in general, but also loss of bone mass. So, a lot of issues can really happen if things are not really caught on time and prevented when they should have been. So let's go ahead and go in a little bit more detail of some of the issues with hyperinsulinemia. So again, after all, not everybody's going to have cardiovascular disease, gout, migraines, hypertension, or enlarged prostate, or is going to be obese. But what individuals with these conditions do have most likely is chronically high insulin. Again, obesity is often considered a risk factor for type 2 diabetes or metabolic syndrome, but this orientation ignores the millions of type 2 diabetics and metabolic syndrome patients who are not obese, not even overweight, again. So all the other conditions listed above occur in many people of all sizes. And honestly, more progressive medical professionals are beginning to see excess body weight as a symptom rather than a cause of metabolic dysfunction, meaning that they thought that obesity is what caused type 2 diabetes and other heart disease and other problems, as opposed to no, obesity is just part of the symptom and a part of the symptoms of the actual root cause of the problems. And that is very true. In functional medicine, holistic health, absolutely. Obesity does not cause directly type 2 diabetes or heart disease or any of that. It can be a symptom along with them, but it's not the cause of it. Let's see. So I'm looking at my notes here. So insulin, is an anabolic hormone. It's very, very important to understand that. It facilitates tissue growth, includes growth of adipose tissue and fat cells. So also is directly anti-lipolytic, what it's meaning that it inhibits the breakdown of stored body fat. That is why some people find it extremely hard to lose weight, even on low-calorie diet. If most of those calories come from carbohydrates, especially refined carbohydrates, people who have inordinate insulin secretion in response to dietary carbohydrates usually find themselves trapped in what is called a futile cycle of eating carbs, burning carbs, eating carbs, burning carbs, with burning fat never really entering the equation. So when people talk about burning body fat, that is called lipolysis, and that is the breakdown of adipose tissue to be used in the cell of the mitochondria for fuel. And that's ultimately, you start to use that energy, therefore reducing the body fat stored. Well, when insulin is continuously high, it'll never happen. There's another hormone called glucagon that when that is low and insulin is high, you never enter into the fat burning cycle, into, people call it ketosis. But insulin has to be low and stable for glucagon to be high in order for you to be able to start to utilize your fat, your stored adipose tissue for energy, whether it's the visceral fat and or the subcutaneous body fat. So basically think of chronically high insulin like a security guard outside the fat cells, ensuring that no fat can escape and therefore be utilized as energy, if that kind of makes sense. So let's talk about why is hyperinsulinemia overlooked? Well, really, the simple answer to this question is that unlike fasting blood glucose, fasting insulin is not a routine part of a standard blood work. It should be, but it's not. It is definitely a more complex and expensive assay, but considering the frequency with which more complex, far more complex and costly tests and procedures are performed on a routine basis, it's really unlikely that expense honestly is the issue. The most likely explanation for why annual checkups and routine blood tests do not include insulin is that most doctors honestly simply are not aware of the wide-ranging and powerful effects of insulin. Now, Dr. Kraft, for many years, has preached that. Remember, he passed away a few years ago at the age of 98. To my knowledge, and you guys can look it up, he's been preaching the Kraft test and testing for insulin for decades. And again, you can't say he was a chiropractor or a natural doctor or somebody else who really has any weight. I mean, he was a licensed medical U.S. physician with very prominent at that, very successful at that, but nobody wanted to listen because there's no money in prevention. That's the key. There is unfortunately no money in interest in prevention. Money is in prescribing medications and doing procedures, and just that's the way it is. It's just the name of the game. But that is the unfortunate fact. And even today, insulin is considered little more than a blood sugar hormone, despite decades literally of research showing the undeniable influence of insulin on things like kidney function, cardiovascular system, reproductive function, fuel metabolism, and many, many more physiological actions. And virtually there's not a single tissue or an organ in the body that does not get affected by insulin. Anyway, as is true for glucose, there's almost, again, really no organ, gland, or tissue system that is not adversely affected by chronically high insulin levels. Insulin's roles in the, in the etiology of so many illnesses has led research to say that, high insulin is the cornerstone, of unifying theory of chronic diseases. And that is very true. That has been known for a very long time. Well, that, of course, why the blind spot? Well, it's not a meaningless oversight that insulin's testing isn't part of routine blood work. Rather, it's a gaping hole, blind spot in, honestly, doctors' ability to identify people at risk for major health complications long before these things develop. In the case of type 2 diabetes, insulin might be elevated for decades before glucose budges into territory diagnostic for diabetes. It might not. The same may be true for Alzheimer's and dementia. How regularly referred, the last, at least that I know, the last 5 or 6 years, to my knowledge, Dr. Perlmutter, he's one of the first ones to officially identify or begin to call Alzheimer's disease type 3 diabetes, or what they call brain insulin resistance. So if health providers tested insulin more routinely, these conditions could be dealt with when there's only some smoke rather than waiting until they're having a raging, blazing, out of control fire. But I said it before, there's no money in prevention. So several conditions I want to talk about is often considered idiopathic, meaning there's, no one knows what causes them. And those can be directly tied to chronic high insulin levels. One of these is, the essential hypertension, high blood sugar. Insulin inhibits renal sodium excretion. And as the kidneys retain more sodium, more water is retained as well, increasing the blood volume and raising blood pressure ultimately. So high insulin also impairs healthy blood vessel function, making the vessels less pliant and accommodating, which also contributes to higher blood pressure. Insulin has the effects on the sympathetic nervous system. They may raise blood pressure. Most people's salt consumption has little to no effect on blood pressure. If that was the case, when everybody stops eating sodium, blood pressure will be affected, and that's really not the case for most of the time. Another condition that fits that description is, a wrongly demonized dietary factor in gout. For instance, animal protein, especially in general, red meat, in particular red meat, is typically blamed for gout, with alcohol and especially beer, kind of like the second, closest second, right? Gout occurs when a compound called uric acid builds up in the body and precipitates into crystals that lodge into the joints. The big toe is the most commonly affected area, but gout attacks can affect obviously other joints. But uric acid comes from the breakdown of purines, which are concentrated in animal proteins, but also found in many, many healthy plant foods. So uric acid isn't a problem in a healthy body that excretes it properly. It's only problematic when it accumulates and solidifies. And the primary driver of that is actually insulin resistance. When I, help, clients with, type 2 diabetes, which they obviously, have issues and have had insulin resistance, but have had chronically high insulin, and they have gout, which is very common. Once you address the lifestyle and the diet, and you, lower and stabilize the blood sugar, optimize airflow, the pancreas gets a break, and little by little begins to rejuvenate the beta cells, and they begin to produce insulin by themselves normally. And the person, continues on a healthy lifestyle and a proper, dietary intervention protocol. Gout disappears with it, along with blood pressure and diabetes, and they have heart disease or heart issues, cardiovascular disease. I'm sorry, that all goes away. But again, it's action is required, and a lot of people, unfortunately, are really not willing to, go that route. So again, in gout, it's really mind-boggling. But the answer is not reducing purine sources, which again means cutting back on some of the most nutrient-dense foods available. But the answer is to reduce, lower, and stabilize insulin levels. Simply stated, health provides, fail to identify, chronic high insulin levels, the primary driving factor in many chronic non-communicable diseases, because insulin testing isn't performed anywhere near as often as really should be. So a great deal of morbidity and early mortality could be prevented if people are made aware that their seemingly inexplainable issues actually have a very clear explanation, and it's something fairly easy to correct, okay? Anyway, enough of that. Let's go to talk about a little bit measuring insulin. So the easiest way to assess insulin status is with a fasting insulin test. Okay, it's not expensive, really. You can do it yourself. You can request one from your doctor. You can go to any of the labs, walk into like any test lab now. They'll do it for you. But if your physician is uncooperative, you can always order a fasting insulin test, from different places. Contact us. I'll prescribe an insulin test for you. I'll prescribe you the full protocol. It's really not that expensive. So be able to, get it done and know what you're dealing with. So reference ranges, they can vary among different laboratories to a point. One of the standards that is usually used is the Mayo Clinics, and their reference value for fasting insulin is 2.6 to 24.9 micro international units, so it's called micro IUs per microliter. Okay. However, most doctors that are well informed and that progressive medicine, integrated medicine, holistic medicine, and regard metabolic syndrome and insulin resistance as the issue, they prefer to see fasting insulin below 10, and some would actually go below even 5. Okay, so if your fasting insulin is double digits and you're experiencing especially any of the symptoms that I mentioned earlier, it's way too high, and you definitely have a problem. Another helpful measurement of insulin sensitivity is the HOMAR test, which is called HOMA-IR, and that stands for Homeostatic Model Assessment of Insulin Resistance. It's a very helpful tool because it takes into account both glucose and insulin. It'll tell you how much insulin your body has to produce in order to keep your glucose at a healthy certain level. So that is how hard your pancreas has to work to maintain homeostasis. A glucose level that's neither too high nor too low, obviously, is optimal. So here's a simple formula I want to give you guys on how to calculate your HOMAR. All you have to do is go to your doctor, get a fasting glucose and fasting insulin test at the same time. And then you're going to use those two numbers that you get to be able to plug it into the formula and measure your HOMAR. So if your testing measures insulin and glucose in the milligrams per deciliter, which LabCorp and Quest, they both do, then the HOMAR equation is very simple. You're going to take the glucose, you're going to multiply it by the insulin number, whatever that is. You're going to take that product and you're going to divide it by 405. Whatever you get, that number there is your HOMAR number. Okay? If your lab that you're using uses micromoles per liter, or is mmol-L, then you're going to do the same thing. You're going to take the glucose number times the insulin number and divide that by 22.5. That's going to give you the same thing. So as with fasting insulin, reference ranges and opinions on what is absolutely optimal somewhat vary, though to a very small degree. But physicians who use, reduced carbohydrate diet and specialize in treating metabolic syndrome, not just medicating it, they'll gauge insulin sensitivity with the following parameters for HOMAR. Excellent insulin sensitivity is when the HOMAR equation that I just gave you is less than or equal than 1. Average insulin sensitivity is about up to 1.75. And if your equation number is 2.75 or greater, then you have insulin resistance. And the insulin resistance, it's your predecessor. It's going to lead to ultimately to type 2 diabetes without fail. So there are many reasons why fasting glucose might be slightly higher than expected, and because it's not necessarily, indicative of a problem. There are many ways. You might be stressed out. You might actually be nervous when drawing blood. I hate giving blood. I hate anybody messing with my veins. I had to look away, so I always get stressed. My glucose number is always going to be about 102, 105. So is my cortisol is going to be slightly elevated. But that's ultimately, if you're only looking at that, by default, you're going to say, well, I see you're pre-diabetic, or you might be even diabetic. Not the case, because my insulin is very stable, very low. So when I do my HOMAR, I'm below 1. Okay. So you really have to know what you're doing. And you owe it to yourself to know. So, because the worst thing you're going to go in there, and I can't tell you how many times I had people that they said, well, I got diagnosed with pre-diabetic. Okay, well, show me your blood, or show me what caused that diagnosis. Literally, the physician was basing it off of a single number, and that is the fasting glucose. And now the paranoid person, the guy or the woman, they started stressing out of their mind because somebody told them that they're diabetic or pre-diabetic. That's ridiculous. I mean, that's doing a disservice. So, we ran the glucose, we ran the fasting insulin, we ran the fructosamine, we ran the H1C hemoglobin. And turns out, the person is not diabetic at all. It's actually very normal. But what ended up happening is nobody asked them. Just like me, they hated venipuncture. If somebody, drawing blood from your vein, really nervous. They got aggravated on the way to the lab in the morning because, traffic was really bad and somebody cut them off. So they got the blood sugar up because, got the blood pressure up from, cortisol release, so getting aggravated. And guess what? It's just a perfect recipe. So when they draw blood, even though they're fasting, the liver starts to make glucose, which is a survival strategy, a response from the normal, healthy human physiology, and end up what? Their blood glucose shot up, and they mistakenly got diagnosed they're pre-diabetic. Doesn't make it. I had some people come and say, I was just diagnosed diabetic. And that was definitely not the case. So you have to know what you're looking at, and you have to know, really the truth. And this is the key to that. Let me give you an example of two patients. So based on the formula that we talked about, fasting glucose times fasting insulin divided by 405. Okay, you have patient A, and their fasting glucose is higher than patient B. Okay, but patient A's insulin is much lower. Okay, so now taking both glucose and insulin into account, patient A hallmark score shows that even with a lower fasting glucose, patient B is a great risk of metabolic complications down the road, because patient B body has to work harder, and that person requires much more insulin to maintain a healthy blood glucose level. If patient B doctor persists in testing only glucose and not insulin, that patient will remain dangerously unaware of serious potential metabolic trouble down the road. So this is why you have to test. So even though patient A's glucose was higher, because patient A's insulin was so much lower, the hallmark insulin sensitivity score of patient A is a healthy range, and patient B was, not in the healthy range. But the physician didn't see that, and that happens all the time. I don't have any charts to show you guys. Unfortunately, I'm really not astute here on fancy videos, but I hope you understand what I'm getting to. All right. So let's talk about a little bit about the Kraft test. If your fasting insulin is in the high double digits, it is a sure guarantee sign that something is wrong. Okay. However, if your fasting insulin is normal, it doesn't automatically mean that all is well either. As with blood glucose, in some people, the fasting level is normal, but it raises very quickly after meals and takes a long time to come back down to the baseline level. So in some people, it might not even come down fully before the next meal. So in such cases, it is possible to have a fasting insulin level in the optimal range, but have high insulin throughout most and the rest of the day. So in most people living with the signs and symptoms of hyperinsulinemia or high insulin, fasting insulin will be elevated and no further assessment will be needed. However, there is also the potential in smaller population that if your fasting level is normal, yet your body is giving you clear signs that you have high insulin, you may want to consider what is called the Kraft test. That, again, that's from Dr. Joseph Kraft. The test is a variation of the oral glucose tolerance test, and is named after, again, Dr. Joseph. And he, the physician that I mentioned earlier, he pioneered the research identifying the harms of the chronic high insulin state in people with normal glucose. And unfortunately, very few people actually listen to him. So unlike the conventional 2-hour oral glucose tolerance test, which only measures glucose, the Kraft test also measures insulin and is extended not to 2 hours, but to actually 5 hours. So this is where the Kraft test shines, honestly, because these two small changes, the insulin and the 5-hour sequence as opposed to 2, provides that valuable information that you won't get from a standard OGTT test. So remember, details matter. They always have and always will. So it was to performing thousands of these literally modified oral glucose tolerance tests that Dr. Kraft ultimately uncovered the staggering scope of diabetes in situ. There's the developing of diabetes, the result of dangerously high insulin in people with normal glucose levels. And ultimately, you can literally see people developing the diabetes way, sometimes decades before they actually become officially diagnosed. So the Kraft test is really not recommended if you feel well, are well, you're satisfied with your health, your body composition is great. However, I always do recommend that people, if they're in the optimal health state in their life, run a Kraft test so they have a great baseline of health. Therefore, if things change over time, they know, how to refer. Obviously, if you're not happy with your health, if you feel like you're doing all the right things, relatively speaking, still, but still you're trying. Yet you still struggle with those signs and symptoms and conditions, knowing, these are most likely, some, if not all of them, are driven by high insulin. So it might be just worth seeing your, glucose and insulin in action together. I mean, at the very least, and do the hallmark insulin resistance test and see. You begin with that, okay? But just think about your health. And again, the point of these episodes is to really push you guys to think about optimal health. What is optimal health? What is, it's a lot easier to prevent something in the first place. It's even a lot easier to reverse something in the initial lower end stages when it begins, as opposed to when it begins to be deep-rooted, long-standing, chronic disease. So always, refer to that. What is optimal? What can I do to learn? What is optimal, and what can I do to take control of my health? Because I promise you this, unfortunately, most of standard, the medicine and the allopathic mode of care is excellent for acute conditions and trauma, especially, but they do little to nothing for prevention and for optimal health. So let's wrap this up here, because I know you guys are probably getting a little impatient. If your insulin is high, what to do about high insulin levels, all right? So if your insulin is high, there are many strategies to lower it. So one is reducing immediately dietary carbohydrate intake. Okay, that is one of the things that honestly is extremely effective, especially in short term, and for this purpose, to be able to begin to reduce insulin. Before I go into more detail here and the other factors, I'm going to make some blatantly clear. When I say reduce your carbohydrate intake, I'm not talking about go ahead and reduce your processed carbohydrate intake, breads and pastas and cookies and cakes and pastries and all this other garbage, including sugary drinks and high metabolic poisons like diet sodas and regular sodas and so forth. These have to be eliminated completely. Like without fail. Like there's no, I'm going to go from a box of Oreos a day down to like 2 or 3. No, there's not. It's out. Okay, so processed food has to go. That's going to be anything made with white, bleached, refined flour, highly refined industrial seed vegetable oils like soy, cotton, canola, sunflower, safflower, and so forth. And any and all forms of refined sugar, especially high fructose corn syrup. Okay, so I got to be blatantly clear here and tell you again, I'm not talking about reduce your junk food intake if you're eating junk food every day, which a lot of you do, unfortunately. You have to eliminate that completely and utterly, okay, like all or nothing, black and white, and at the same time, reduce healthy carbohydrate intake. What is healthy carbohydrates? Well, potatoes, sweet potatoes, yams, non-glutinous grains, especially, teff, millet, quinoa, oatmeal, rice, white rice or brown rice really makes no difference. But these have to be reduced, okay? Generally speaking, depends on the person, depends on their activity, but, less than 100 grams, at least less than 150 grams of total carbohydrate per day is essential. That also is going to include fruit too, okay? So that is very important. And that's what I mean when you say reduce carbohydrate intake. You have to take out all the processed food completely. And reducing the carbohydrates only refers to actually healthy sources of whole food-based sources of carbohydrates. Now, not everybody, you have to note and be appropriate to insist that not everybody everywhere has to cut back to extremely low ketogenic levels of carbohydrate consumption to prevent chronic high insulinemia, diabetes, and so forth. Okay, not everybody needs to do that. It really depends on the person's situation. There's many factors that are there, and they're going to determine. Some people don't. Some people have a very well balanced carbohydrate intake. Again, processed food is eliminated completely, but there are people that do 300 grams a day of carbohydrates, especially they have a large muscle mass, they're very active, generally they're healthy, have a other good, high quality balanced macronutrients like the proteins and the fats in the diet, they don't really need to go that high. That really depends on the person. I cannot give a concrete answer here because I can't guess. You have to test. Okay, you have to see where you're at. There's other factors that play a role in that, but not everybody needs to go to these extreme levels. Okay. Now, usually, generally speaking, once someone is already down the disease path and is dealing with heavy conditions that are stemming from high insulin, he or she would likely definitely benefit from an intervention more drastic than the strategy. Just a person who is going down that route, the person who's already been and has been that route for a long time, is suffering, has drastic symptomology. The numbers are showing on those tests are very bad. Yeah, they'll definitely benefit at least short term of drastic carbohydrate reduction. A healthy person, on the other hand, who might have the slightly off, then maybe on the borderline, they would not have to have that kind of drastic intervention. Always keep something in mind, and that is a law here. That's what is required to reverse a full-blown illness isn't necessarily required to prevent it from happening in the first place. Back to the point, it's a lot easier to prevent usually something from happening than actually it is to treat it. So the more complex the chronic disease, the longer the standing it is, the more deep-rooted it is, especially if it's 2 or more, it requires more time, more energy, more effort, and more drastic measures to reverse it. Okay, keep that in mind. Also, again, with the increased popularity of ketogenic diets in general, carbs are getting a bad reputation. And that is not something I can talk here because it'd be a whole nother podcast. But eliminating carbohydrates indefinitely for most people is not a good idea. Okay. There's a lot of reasons for that, but gentle, high quality, whole food based, healthy carbohydrates have a phenomenal effect on the physiology of the body, numerous reasons. So just always keep that in mind. Okay. Because a lot of people going to the school of full blown ketogenic diets, absolutely no carbohydrates. And that's not good either. Another thing, if you have high insulin levels, chronically elevated insulin levels of that, you want to cut down your fruit intake. Healthy fruit, especially organic fruit, is obviously very healthy, but still, even though fructose does not require the same insulin response per gram ingested as regular or let alone refined sugar does of insulin secretion, is problematic and can be problematic if overconsumed. So once you stabilize the low insulin, you address the high insulin levels, then you can go back of having the fruit that you usually like, but just keep that in mind for that. Also, a lot of it's a fact a lot of people know this, and again, carbohydrates. There's no doubt. Obviously, refined carbohydrates from junk food, processed foods, they have the worst effect on glucose and insulin. The worst, hands down. Yeah, if you actually do the research and see what the requirement is, say, for the gram equivalent of ingestion of high fructose corn syrup for the body to produce insulin to bring down the blood sugar down to normal levels, is as opposed to the ingestion of coconut sugar or unrefined thing like date syrup or something, or honey. It is a big difference. So if you ingest, say, 5 grams of high fructose corn syrup and 5 grams of local raw honey, even though the sugars are the same, the molecular structure of the high fructose corn syrup is not natural to the human body. And it does tremendous amount of damage. One of those is seen because the insulin required to bring the blood sugar down to normal levels of that 5 grams of high fructose corn syrup is enormously higher than the equivalent of the honey. Carbohydrates in general, they arguably have the largest effect on insulin levels. Of course, it's not the only factor, obviously, but carbohydrates, have to be lowered again, and that only pertains to, as I said before, healthy carbohydrates and not, processed food. Exercise, vigorous exercise, high intensity exercise, and physical activity in general tremendously improves insulin sensitivity. One of the fastest ways to lower blood sugar is to be involved in a high intensity exercise, to some degree on daily basis. It's amazing what it does. Okay, it's very healthy. Sleep. Sleep is very important. Sleep deprivation is now recognized as a risk factor for metabolic syndrome and type 2 diabetes without fail on many different levels, owing to reduced insulin sensitivity and changes to levels of hormones that regulate appetite, energy expenditure, and so forth. So that's very important. Make sure that you sleep. Okay, is the quality and the quantity of sleep. Another thing is eating regular meals. Having a regular eating schedule. It can be breakfast, lunch, and dinner. It can be just 2 meals a day, but not having your body keep guessing all the time, having regular meals. A lot of them, it can be 4 meals a day. That's okay. It just as long as they're regular and structured properly. A lot of people, ask about intermittent fasting. Intermittent fasting can definitely be a great help for reducing insulin and improving blood glucose levels. Again, that's only if you actually remove the processed food from your life and your diet completely. And we only talk about eating wholesome foods, but intermittent fasting can be very effective. It's another tool that you can add to your toolbox. Usually, the simplest way is to fast for 16 hours and have like an 8-hour window. For example, you might sleep 8 hours or so, not eat breakfast, obviously hydrate really well, and eat lunch or somewhere around there, and then another 5, 6, 7 hours later, eat another meal, like your dinner. And again, those have to be no processed foods and really well balanced. So that's another effective strategy to be able to really reverse that. Full-blown fasting and water fasting for days on end, even a few days, that's not something you want to do by yourself unless you know what you're doing, because there's a lot of other complex issues that are in play nowadays, and people can get in trouble. So just keep that in mind. Another very important thing is doing a food sensitivity test, knowing what IgG immune response is, okay, and not food allergy, but food sensitivity test. You might be eating a healthy diet, things like organic broccoli and berries and chicken, turkey, whatever. But if you're sensitive, especially if you have severe sensitivity, that's adding chronic inflammation, and it does affect, or it can affect, blood sugar levels and insulin response. A lot of people don't know this, but that is a very, very big truth that is very prevalent. I say in my practice all the time. People eat really a structured, well-balanced meals, but because they have GI issues and they have insulin sensitivities, their blood sugar fluctuates and the insulin response fluctuates quite a bit. So that's a very, very big and important factor. Food sensitivity testing. Another one is look at your gut, look at the gastrointestinal health. How's the structure and function of your gut? That's extremely important. Do a special test. It's called the GI map DNA stool test. It's a very comprehensive test that looks for many markers, inflammatory markers, looks for pathogens, looks for dysbiosis, digestive enzymes, and so forth. That it really can make a big difference when you address. Also, again, you can do the Kraft test. The Kraft test is something that, unfortunately, it's very hard to find. Very few labs do it. A lot of times you actually have to be at the place to do it, the lab itself. And it's not something that, easy to find. We do offer the Kraft test. If you guys like, contact us, and that's something that we can do for you. We can do the GI map test, stool test. We can do the IgG immune response, food sensitivity test. Again, these are things that really easily can, you can see where you're at on many different levels, not just regarding insulin sensitivity. If you just want to use the glucose, fasting glucose and fasting insulin test, again, we can help with that as well. But, know what you're dealing with, know yourself, know the issues you have, know where your numbers are. It is important. It does make a difference. So just to kind of recap things here, basically, when it comes to metabolic health and proper glucose regulation, blood glucose tells only small part, of the tale. Even when blood glucose is normal, chronically high insulin exerts a powerful influence over just about every single organ and tissue in the body, right? The kidneys, the brain, the reproductive system, the cardiovascular system, and more. Don't let a normal glucose level check trick you into thinking that everything is fine, especially if your doctor tells you so. Especially if you know that you don't feel your best. Okay, you gain weight, you can't lose the weight, you don't sleep the best, you don't feel the best. So stay on top of your long-term health. Have your insulin levels checked periodically, along with with your fasting insulin, and take precaution to take care of your health. All right. So I'm going to go real quick over to just real quick of the key points that we talked about, because I know I talked a lot and I don't have any graphs or charts, but if you guys catch that, at least you know where we stand. So again, chronically high insulin, hyperinsulinemia, that is the culprit in many serious health problems, even when blood glucose is normal. Okay, there's not a single organ or gland or tissue that is not affected by chronically high insulin. Blood glucose or blood sugar measurements may appear normal because glucose is being kept in check by the sky-high insulin. Normal glucose due to high insulin is much more common than people recognize, and it's a problem. You got to test to know. Don't guess, don't hope, test. Okay, insulin resistance is often associated with being overweight or obesity, but millions of people are at normal weight or even underweight and have chronically high insulin and are at risk for serious health problems. Insulin testing isn't part of routine blood work. It should be, but it's not, reflecting a blind spot in the ability to identify people at risk with major health complications long before they develop. Okay, when insulin testing levels, it's possible to have fasting insulin levels in optimal ranges. Remember that, but have insulin throughout most of the or rest of the day that is high. So if the fasting level is normal, but the body is giving clear signs of high insulin, then at that point, strongly suggest do the Kraft test. Not everybody needs to be, remember, to address high insulinemia on very low, strict, full-blown ketogenic diets. Okay, they don't. But if somebody already has one or both feet in the door of the metabolic syndrome and they're struggling, it can be a short-term, at least a very high effective strategy to go by. Remember sleep. Sleep is important. I'm going to do a whole nother talk on sleep, and I cannot tell you, people think it's easy. It's not easy. That's why you have a sleep epidemic. If you don't believe me, do the research. But sleep deprivation is recognized as a risk factor for metabolic syndrome, among many other things, such as cancer, and owing to reduced insulin sensitivity and changes to the levels of hormones that regulate appetite and energy expenditure. Don't sleep and see how much more hungry and craving will be. Try and you'll see. Intermittent fasting allows insulin levels to normalize and can give the body more time in lower insulin state, which is a great tool to add on to a healthy lifestyle and diet. You're not going to intermittent fast and eat your processed food and then get your insulin check and normal. That's never going to happen. Okay, so a lot of people think intermittent fasting, I'm on my way to health. You're not. That's just a tool. Okay, in addition to the baseline. And the baseline is what? Healthy lifestyle habits, and above all, sound nutritional intervention. Lastly, don't guess, get tested so you know, be in the know. Do a Kraft test, do a IgG Food Explorer sensitivity test, see how your gut functions, do a GI map DNA stool test, see what you got going on, okay? If you guys have any questions or you need anything more, go to my website, drpnd.com, it's drpnd.com. And at the top of our website, you'll find all of our lab testing and reach out to us if you have any questions to reclaim your health. Again, thank you for listening again. And I'm your host, Dr. PND. And I hope you guys have a wonderful and healthy week. See you next time.
Thank you for your valuable time and for listening to the Your Health Reclaimed podcast with Dr. PND. Be sure to hit the subscribe button and share this episode with a person you know it can help. If we can help you in any way, or you would like to connect with Dr. PND, please visit drpnd.com. That's drpnd.com.